What's up, everybody? I'm Dr. Josh Yagoda. Today I'm going to talk about frozen shoulder and some of the most common symptoms that you are going to find. Now, frozen shoulder is commonly affected with diabetes, heart disease, thyroid, and possibly even prostate. But most of the time it's actually idiopathic, which means we don't really know where it comes from. It can be coming from, like I said, some of those illnesses or diseases that I just mentioned before. As a result of lack of blood flow, and it could also come as a result of trauma. But either way, we don't necessarily know. But the most common symptoms that you're going to find is progressive loss of your movements, right? So as you start to move your shoulder, arm, and things like that, you're going to notice a decrease in your range of motion. So for one day, you might be like, oh, it really starts to hurt or pinch, and you realize like that you're limited in your movement. One of the most common examples that we'll see is you out there or anybody out there will be placing a cup or a glass or something on a cabinet, and they'll have the inability to do that as a result of the pain and the discomfort. Oftentimes people have a lot more pain in this little area, like right through these areas up in the shoulder. You'll see them start to do stuff like this when they start like lifting. They'll start kind of like hunching over like that. Mostly with women, you'll have difficulty putting on jackets or sports bras. They'll have a lot of pain doing this. For men, another common symptom you'll see is the inability to reach behind their back and grab their wallet or something, because a lot of guys keep their wallet in their back pocket. So when you ask people to do stuff like this, they'll have a lot more pain in the front of that shoulder, and they'll have a lot more reduced range of motion, as I said. And of course, one of the more common things that you'll find is difficulty sleeping. So as you notice, when you have that frozen shoulder, that difficulty with this range of motion, you have increased pain, your mobility is down, you're going to end up sleeping on that shoulder. Not maybe on purpose, but maybe because of it's part of a habit. So as a result of that stiffness, that tightness, that discomfort, that pain, a lot of people, when they roll that shoulder forward and sleep on it and compress it, it hurts a lot more and it wakes them up. So you're going to really have those three things: the inability to kind of elevate and raise the arm with the reduced range of motion, a severe amount of pain through that area, and the inability to kind of like internally rotate and put your arm behind your back. And that's one of those three things that you can really look forward to seeing. Well, I wouldn't say look forward to seeing, but look into seeing if you're having a frozen shoulder, because sometimes it doesn't show up diagnostically on an x-ray, and you're not going to see a lot of things. You're not going to know how you heard it, but these are the common things that you're going to see. And in the next episode, we're going to talk a little bit more about treatment. In future episodes, we'll talk a little bit more about some things that you can do to help alleviate this pain. All right, guys? I'm Dr. Josh Yagoda. Thanks for stopping by. We'll see you guys for the next episode. Bye, guys.